My name is Dr. Maria Wolfs. I'm an endocrinologist, which is a hormone specialist, and I have an interest in women's health. And I'm going to speak to you today about hormonal causes of irregular menstrual cycles. The endocrine system is made up of several organs called glands that make and secrete hormones. These hormones are messengers that travel through the bloodstream from one gland to another in order to direct the function of these organs. The three main glands responsible for ovulation are the hypothalamus, which is the master hormone gland that sits high in the brain. Number 2, the pituitary gland, which sits in the brain behind the eyes. And number 3, the ovaries, which sit in the pelvis. The hormones made by these three glands contribute to the delicate and unique process of ovulation. And if any of these hormones are off, the other glands respond by shutting down ovulation, which leads to irregular menstrual cycles. The menstrual cycle is counted from the first day of one cycle to the first day of the next. An irregular cycle is between 21 to 35 days. For the first few years after menstruation begins, the cycles might be longer and irregular, but with time, they should become normal and regular. Again, as menopause approaches, the cycles become shorter and irregular again. The main hormones produced by the ovary are estrogen, progesterone, and testosterone. High testosterone levels can interfere with ovulation and cause symptoms such as oily skin, acne, hair growth along the face, chest, or belly, and scalp hair loss. The most common cause of increased testosterone production by the ovary is polycystic ovary syndrome, or PCOS, that affects up to 5% of women in North America. A much more rare cause is increased testosterone production by the adrenal gland in a condition called congenital adrenal hyperplasia, where there is a blockage in normal hormonal production that leads to a backup of testosterone. This condition can onset in babies or in a much milder form called late onset congenital adrenal hyperplasia that can occur in teens and adults and looks very much like PCOS. Primary ovarian failure is when the ovaries stop functioning before the age of 40. And this can occur due to chemotherapy, radiation, surgical removal of the ovaries, chromosomal defects, or autoimmune disease, where the immune system attacks the cells of the ovary and destroys the eggs. The pituitary gland makes several hormones, including LH and FSH, which are the main directors of ovulation in the pituitary gland. If the pituitary gland is destroyed by surgery, or tumors, or radiation, these hormones will not function and ovulation can't take place. The pituitary gland also produces other hormones that can affect menstruation. Prolactin is a hormone made in the pituitary gland and is normally increased in pregnancy and breastfeeding, but can also be overproduced by small benign tumors of the pituitary gland called prolactinomas. High prolactin levels shut down ovulation and lead to irregular cycles. The thyroid gland is directed by the pituitary hormone TSH, or thyroid stimulating hormone. Too little thyroid hormone or too much thyroid hormone due to over or under stimulation of the thyroid gland by the pituitary also interfere with ovulation and can lead to irregular cycles. The The hypothalamus is the master hormone gland of the body, and it oversees everything around ovulation. If the hypothalamus senses that the body is not ready for ovulation, either due to too much stress, emotional or physical, too little fat stores, too much exercise, or too few calories, it will shut down the entire process of ovulation at a very high level. This type of hypothalamic amenorrhea often requires support and counseling to reset the hypothalamus to ovulate again. In order to assess the different hormones that impact ovulation, your doctor may choose to test the key pituitary hormones, LH, FSH, prolactin, and TSH, the ovarian hormones, estradiol and testosterone, as well as beta-HCG, which is a pregnancy test to make sure that the irregular cycles are not caused by pregnancy. Because the hormones made by the pituitary and ovary vary over the course of a day and vary over the course of the menstrual cycle, it is important to time the tests correctly. All hormonal testing to assess for irregular cycles should be done before 9 a.m. in order to catch the early morning rise of several of the hormones, as well as in the early part of the menstrual cycle in the follicular phase. Often, people are instructed to do their blood work between cycle day 3 and 5, with cycle day 1 being the first day of menstrual bleeding. If a woman has been more than 3 months without a menstrual cycle, her doctor may ask her to take progesterone for 10 to 14 days to cause a menstrual period, after which time she can do her blood work. We have had a chance to review the endocrine or hormonal causes of irregular cycles. The ovary, pituitary, and hypothalamus produce hormones to set up the right environment for ovulation to occur. And if any one of the hormones in this process are affected, the other glands shut down ovulation. By checking the pituitary and ovarian hormones in your blood, your doctor will best be able to help you understand the cause of your irregular cycles and how best to treat them.